Hello, I'm Dr. Rohini. Today I'm going to talk briefly about pelvic inflammatory disease. So, what is this condition? So, in pelvic inflammatory disease, usually there is infection of the lower genital tract, that is the uterus, the vagina, and the cervix, and the fallopian tubes, and also the ovaries. So usually, what are the symptoms with which patient comes to the clinic? One is that patient will complain of severe pain abdomen, and they'll also complain of severe foul-smelling vaginal discharge. They'll complain of difficulty in or burning sensation while passing urine, and they'll have severe pain during periods, and they'll have pain during sex, and also they will have complaints of infertility. And sometimes they may also complain of having a mass or swelling in the tummy. So these are the common symptoms with which patients come to us. Now, what are the findings that when we examine the patient, what are the things that we find? So usually patient may have fever also. So my patient may have temperature, and on doing an abdominal examination, patient may have severe pain on palpation, and there may be some mass also, mass or swelling in the tummy. And also on doing a speculum or internal examination, we may find some inflammation over the cervix or the vagina, or and they may also be a lot of foul smelling discharge. And there are certain tests that we do to confirm the diagnosis. One is we do a total blood count, that is the WBC count, and then C reactive protein, which gives us an idea whether there is some ongoing infection. Apart from this, we also check the urine for signs of infection, and if the patient comes with fever, we also do a blood culture. And if there is any vaginal discharge, we take the swab of the vaginal discharge and we send it for culture to find out what kind of organism is there. Okay, and the next thing would be to do an ultrasound. In case of an ultrasound, what things that we expect is some, if there is any infection, then there may be swelling of the tubes, which we call as hydrosalpinx. There may be some swelling in the ovary, which are due to pus collection, which we call as abscess. Sometimes it may affect the lining of the endometrium, and the lining of the endometrium may become thin. So these are some of the findings that we find on an ultrasound. So whenever we have this kind of suspicion, then what usually why we are afraid about PID is that it can cause permanent damage to the tubes, to the ovary, and also the uterus. Sometimes after this, because whenever there is some inflammation processes there in the body, it usually heals by causing some scarring or fibrosis. So this may affect permanently the tubes, and this may affect the endometrium and make it thin, and it may impact patient's ability to conceive naturally. So whenever we have any high suspicion that the patient is having this condition, then we start on treatment. The treatment is usually we give some painkillers if she has a lot of pain, and then we start her on antibiotics. Usually antibiotics are given over a course of 2 weeks, and usually we treat both the couple, the husband and the wife, both are treated in this case. And in this period, usually we tell the patient couple not to abstain from having sex, and maintain a good healthy lifestyle and take the medicines continuously. And then we follow up the patient after 2 weeks and see if the discharge has reduced or not, if the pain has reduced or not. In case she has persistent discharge, then we follow up the swab for culture sensitivity, and then depending on it, we change the antibiotics and monitor the patient. I hope my this small talk was informative about the condition. In case if you have any doubts, you can always come and meet us in person. And if you have any of these symptoms, like a lot of vaginal discharge which have with itching, or if you have fever with pain in your abdomen, and or if you have very heavy periods, or you have pain during periods or pain during sex, and difficulty in conceiving, so these are some of the symptoms of pelvic inflammatory disease. Please come and visit and get a checkup done.